Imagine falling asleep while driving your car or during an important exam. This is the reality for patients that are diagnosed with narcolepsy. Narcolepsy is a neurological sleep disorder that makes it difficult for the brain to control sleep-wake patterns. The defining characteristic of this disorder is that patients will often find themselves falling asleep during the day and will have fragmented sleep patterns at night. The disorder affects roughly 3 million people worldwide, affecting both adults and children, with most people having symptoms before the age of 18. The condition often gets undiagnosed since many people may be seen as lazy for constantly sleeping, and it's often misdiagnosed for depression or obstructive sleep apnea due to overlapping symptoms. It's important to understand how this condition happens, understand its symptoms, and to find treatments to help those suffering from it.
So what causes narcolepsy? Narcolepsy develops due to changes in the hypothalamus. This region regulates the release of chemicals that mediate different activities of our bodies, like sleep. Sleep is regulated by the neuropeptide hypocretin, released by the hypothalamus. There are two forms of hypocretin, 1 and 2, believed to act as excitatory neurotransmitters. They cause the individual to be awake during the day and help with sleeping throughout the night. Narcolepsy is believed to be an autoimmune disorder, which is when the immune system attacks healthy tissues in the body by mistake. In this disorder, the immune system mistakenly attacks neurons that produce hypocretin. Narcoleptic patients lose about 90% of the normal number of neurons that produce hypocretin. Two explanations for why there are dysregulated immune reactions happening may be due to variation in HLA class II or due to enhanced autoreactive T cells, which may work together to reduce hypocretin neurons. The human leukocyte antigen class II is the human form of MHC molecules, which are responsible for presenting antigens to T cells that induce an immune response. Researchers have shown that 95% of narcoleptic patients are positive for a genetically modified allele of the gene encoding for HLA class II, commonly associated with autoimmune disorders. Another key player in the onset of narcolepsy are autoreactive T cells. Autoreactive T cells are present in healthy patients, but they are properly controlled by the immune system. But in autoimmune disorders, this control is skewed and they become harmful. There are two forms of autoreactive T cells, CD4 positive and CD8 positive, which are present in greater amounts in narcoleptic patients. CD4 positive T cells are important in triggering the clearing of an infection, but are not cytotoxic. Researchers believe that the enhanced CD4 positive T cells help indirectly promote the generation of more CD8 positive cells that have cytotoxic abilities, making them able to directly kill the neurons.
To explain the symptoms of narcolepsy, it is important to understand REM sleep. This is a sleep state that is characterized by the individual experiencing dreams, temporary paralysis, and loss of muscle tone. Narcoleptic patients enter REM sleep within 15 minutes of falling asleep, which is very rapid compared to the normal 90 minutes taken to enter REM sleep. The REM sleep state and wakefulness states do not get mixed up in healthy people. Those with narcolepsy do not have a good distinction between awake and asleep. Elements from these two states can mix, which triggers some of the symptoms of narcolepsy. The first symptom is excessive daytime sleepiness, where people fall into REM sleep at any time during the day, no matter what they are doing. Narcoleptic patients also spend less time in REM sleep, resulting in fragmented sleep patterns, where the patients continually wake up during the night, resulting in negative impacts on overall sleep quality. The mixing of dreaming from REM sleep and wakefulness can cause hallucinations at the beginning or end of the sleep period. These hallucinations are often terrifying for the patient as they can see, hear, or feel frightening things. The fourth symptom is sleep paralysis. Normally, the voluntary muscles of the body are paralyzed during sleep. This paralysis is normally worn off before we wake up, but this is not the case during narcolepsy, resulting in the inability to speak or move before sleeping or shortly after awakening. The last symptom in narcolepsy is cataplexy, which is characterized by a significant loss in muscle tone while awake. This mimics the loss of muscle activity during REM sleep.
Now on to treatments for narcolepsy. Narcolepsy currently has no cure, but there are ways to alleviate symptoms. The first line of treatment for patients that exhibit EDS are CNS stimulants such as modafinil. Modafinil increases dopamine and noradrenaline in synapses, which act as wake-promoting neuromodulators. This is done by blocking the reuptake of these neurotransmitters. Modafinil will not have effects on cataplexy, but will help patients stay awake. Modafinil is less addictive than other stimulants, but there are still a few side effects, such as headaches, nausea, anxiety, and muscle pain. Tricyclic antidepressants, such as imipramine, are used for cataplexy attacks. These drugs work by inhibiting reuptake of serotonin and norepinephrine, thus increasing their levels in synapses. By increasing these neurotransmitters, this leads to a reduction in REM sleep. These drugs could also have effects on other REM abnormalities such as sleep paralysis and hallucinations. Side effects of imipramine include headaches, dizziness, vomiting, and dry mouth. Narcolepsy is still a growing field of research. Although the mechanism and symptoms are well characterized, better treatment options must be developed to improve the quality of life of those suffering.